Are you congested?
A little. It's mainly because I just had
Are you a little bit congested?
a little groggy and my chickpea
Oh,
curry.
that's a good way to sort it out. It gets
and
it out of your system.
seriously gets me going.
Oh, did you just hockey on live?
No,
That
was
really
nothing
gross.
there, but it does. It makes me like blow my nose and.
I feel like we're letting everybody stare at all that photo of our children up there. Sorry about that, peeps. We're way more important. Hey, Jed. Hope you're going well. Thanks for joining us, folks, those of you who have. We thought we'd talk a little bit about sinus congestion. Hopefully our weather is starting to improve here in Melbourne, but I don't know. There's something about lockdown that
I was
just...
going to say for those hay fever sufferers might not be so
It's
happy.
the other way around. It's heading
The
up, isn't it?
blossoms
It's
are
ramping
out.
up.
It's beautiful. A few sunny days.
It's not so good if you're a hay fever sufferer. But we thought we'd talk to you guys about congestion, that pain, that discomfort that you can get right through this area here, which can come as a result of fighting off an infection. And sometimes our body gets to the point where it just gets heightened. It gets to that point that it just overproduces mucus, and then it kind of gets blocked up in our sinuses, and it can create
It's gross.
awful pain, and you just can't think clearly. It's like you're clogged with... Ugh. You just can't think. It's horrible. It feels awful. It's non-productive. Well, actually, it's productive, but it's not productive to work or to sing. God forbid you try and sing. Gosh, that's impossible.
Yeah, that would be bad.
It's pretty bad. So we
Does anyone
thought...
have a house family member that hocks in a sink and lets it sit there?
Oh, that is foul. Nobody does that in here, do they?
No.
No, I was going to say there's 10 of us. So
Only if I've done it at night and I haven't seen it because it's dark.
Mary's just saying this is going to be good to watch because she's just recovered from 3 weeks of viral infection. Mucus build-up was disgusting. Yeah, totally hearing you. Yeah, I have too, but who cares? Oh, no, I don't. What was mine? Corn. It was stuck
You
in
had
my
corn
teeth.
in your teeth.
Anyway, so we're going to take you through an awesome technique that I use in clinical practice that you guys can do at home with your sinus roll-on. We're going to take you through how to do that. But most importantly, it's important to understand just a quick distinction because, as Em said, at this time of year, we are starting to head towards some hay fever issues. So with the weather at the moment, we've had a couple of sunny days and then it was freezing again today. That does tend to upset the sinuses, unfortunately. But generally speaking, sinus comes with an infection of some sort, bacterial or viral infection, which then the body traps. I've got to tell you, having a bit of mucus is actually a good thing because it's your body's defense mechanism working properly. I know it sounds awful, it feels awful, tastes awful, it's not fantastic, but it captures the little bugs before they get down into your lungs. The whole idea of congestion in this top area here is that it's capturing the virus and the bacteria. It's creating this sticky mucus to capture it, which then the design of that is for you to get it out, blow it into a tissue, discard it, or sometimes it ends up down the back of our throat, ends up in your stomach, not in your lungs, in your stomach, which then has high acid content, which kills the bacteria. So it's actually productive. It makes sense. So having increased phlegm and mucus is actually a good thing. It is your body working towards getting rid of the bug. So it is actually a positive thing. I know it sounds silly.
It's like, it's like, oh, it's back in my throat. And you got nowhere to spit it and it just goes down.
It's like oysters. It's not great, but it is a positive thing. And unless you do that on a repeated basis, where you can actually start to feel quite nauseous, it is actually one of the methods of your body getting rid of it. Like I said, that acid in your stomach has a tendency to kill off those bacteria and viruses, which is a good thing. So if you've got mucus, it is a good thing. Having said that, when it blocks up in that area, you've got a lot of it, it can lead to huge amounts of pain, sinus headaches. And like I said, that inability to think clearly. So if you're trying to function throughout your day,
sometimes you just can't get rid of it. You try and hock it out and it just is stuck
there. And we're going to take you through a technique to be able to help loosen that little guy up and get rid of it. Most important thing with this is when you've got an infection, make sure you're drinking plenty of water. Super, super, super important because that really does help to get rid of this issue. And the second thing is, once you've done the technique we're about to show you, you must get rid of the mucus. Okay, don't keep swallowing it, or like I said, you'll end up feeling a bit sick.
Or it dries like wheat bix.
Yeah, please don't spit it on your what is that place that you clean yourself where the water comes down and you use the soap?
Shower.
Yeah, in the shower. Don't spit it on the side of the shower because it'll get stuck there.
Yeah, no one will know what it is.
I don't joke. I did a technique like this on a child, and then I encouraged them to go home and do the steam technique, which I'll talk you through in a minute. And I said to him, do whatever it takes, mate. Get rid of it in any way that you can, whether you blow it out your nose or whether you do all this. I was doing all sorts of noise. He was killing himself laughing. He thought it was hilarious. And then when his mum came back in with him the next week, he's like, this time can you please instruct him to spit it down the plug hole, because it was really difficult to get it off the side of on the window part of the shit. I'm like, oh, sorry about that. Didn't realise I would have to be that specific, but that's okay. He was a boy, so there you go. All right, so what we're going to do, don't laugh at the water. Huh, Elaine's having a dig at you because you were laughing at drinking water. Were you laughing?
I was.
Disgraceful.
I was smirking.
Disgraceful.
Never happened in my lifetime.
Never. No. She's shocking. After a couple of failed colonoscopies, she's still not drinking enough
Trying.
water.
I'm only just getting my appetite back. Not for water, though.
Yeah, good excuse. Unbelievable.
Kombucha.
So we're going to take you through a sinus technique. If you are suffering from hay fever, I'm going to suggest that you use the roll-on, the hay fever roll-on, in the same locations, because the hay fever, they've got two different lots of essential oils in them made for specific different reasons. The hay fever, very much the essential oils of those are specific to help with the antihistamine response and to mend damaged epithelial cells, so the lining, the mucosa of your nose, sinus passages, everything. All of that is related to obviously healing and producing mucus and that sort of thing. But when you've got hay fever, an allergen of some sort, whether it's pollen seeds or grass seeds or whatever it is causing your body to react adversely and increasing the production of mucus, because it perceives it as a foreign object, and it starts to create this defense. And it creates all this histamine, which then gives you the itchy, runny, red eyes, oh my Lord, the worst, and the congestion, etc. But it's quite different in how it presents. A lot of people go, oh, is it sinuses? Is it hay fever? But those itchy eyes and the running eyes and that sneezing response that you get is a sign that you would use the hay fever roll-on in the distribution that we will show you, as opposed to the pain of the sinuses, where you would use the sinus, because we're using this to help break down. So we want to be able to expectorate and get rid of the mucus. The body produces mucosa, which sort of sticks to it gets viscous, really sticky, and it sticks to your sinus areas. We want to break that down so that you can expectorate it or get rid of it, as opposed to hay fever response, which is like the cells are swelling and the actual epithelial cells become damaged. And that's why we've chosen the essential oils we have for hay fever. So they're different. It is important to get it correct. If you're not 100% sure, you can use one and then the other, because sometimes you can get a sinus infection because your cells are so heightened as a result of hay fever. Bit of a combination.
I don't get hay fever, but it smells like Christmas.
It's grass, yeah. The hay fever is awesome.
It's really nice.
What's in the hay fever? You got sinus there.
I got a sinus. Okay, the hay fever.
Oh, that's warm.
Has rosemary, peppermint, lavender, caraway. Is it warm?
It is, because you're
caraway,
holding on to it.
Clove and sandalwood.
Yeah, so that's the hay fever. So if you're suffering from the itchy, sneezy, all of that jazz, under here, above here, like we're going to show you, of the hay fever, you can burn the pure hay fever blend in your oil burner diffuser. So have that going during the day if you're a hay fever sufferer, anything like me, and you're sneezing your head off at this time. What I love is that one of our girls suffers pretty bad hay fever, and she doesn't realise it, but every time she comes out to the kitchen to grab a cuppa, she's been treated by my diffuser. I love it. And then, of course, you use that on these points here, because the mucosa is where you want to heal. So that's important.
This has got menthol, eucalyptus lemon, rosemary. That'd be rosemary. Peppermint, thyme, frankincense.
Okay, so this is the sinus one. So diffuser for the pure essential oil. These roll-ons with the awesome obsidian roller are specifically for your skin, because they've been diluted with jojoba oil. You cannot put pure essential oils onto your skin. You will burn your skin. It is important.
Do it.
Essential oils are strong, they're potent, they're very effective, but you must dilute them. In case you're wondering, it has to be 2% or less so that it's safe. We've got it at the highest that you can. So if you're super sensitive, just try a little area to begin with to make sure that you're okay with using such a high percentage of oils, but you would never want to go above that because of the fact that they are super, super strong. Okay, so the other thing that you can do to assist, because a lot of people have asked us about this as well, when you've got any type of sinus infection, it is an infection. So you want to boost your immune system, and that's when we would recommend the Ultra Immune Relief Spray. So a couple of sprays of that in the mouth 3 times a day will heighten your body's immune response to start helping to fight the bacteria or the virus. Whereas with the hay fever, you are looking more at a specific remedy that will heighten your healing and antihistamine response, which is the Ultra Hay Fever Relief. Okay, so let's go through and do this. Can we do this on you? It's going to mess up your makeup.
It is, but I'm not wearing much, so go for your life.
Excellent. So we're going to get Em to lie down so that I can show you this technique. First of all, we're going to start with some pressure points. So actually, we might show the pressure points while you're up so that people can get the context of your face, because sometimes when you're laying down, people like get a bit confused with which way's up and which way's down. So there's a couple of spots that we would get you to use. If you can get somebody else to do this on you, it is so much better, because when you start poking on these and they're sore, you won't put as much pressure on them.
It's true.
So if you've got someone in your family that feels like they want to get their own back on you, get them to do this
a little bit of pain. Yep.
This is important, and I would always do this, as you'll see in a moment, sitting behind Em, having her lay down in front of me so that I can apply a bit of pressure towards myself. So the two spots that we're looking for, particularly to start the points, are in between the nose crease here. The maxilla comes along here, the cheekbones, and we're wanting to get up and in underneath that spot on there. That's the starting point. And then you literally just follow the points along with your fingers on the cheekbone. So if you just have a feel of your face right now, where that crease of your nose is, and stick your fingers up and in, sorry, that looked really rude. Stick your fingers up and in there. If you've got any sinus issues, you will notice that they are quite tender, and then you just gradually move a finger width at a time across and over and about here. If you've got sinus points, normally they're really, really tender. And this is just helping to stimulate those sinus pressure points to be able to relieve and release the tension. And like, seriously, when you're done with this, you'll be wanting to, in fact, it's happening to me already. I don't even have a sinus issue.
It makes you look rosy.
Does it? Am I looking rosy?
Beautiful.
Oh, thanks, baby. So we start here, working all the way around to about here. I know they are quite tender. When I do this in clinical practice, I can let you know which side is full of mucus because I can feel it with my fingers. I'm not expecting you guys to be able to feel that.
Well, like I said, I just had a really hot curry, so I can feel I'm mucusy.
Yeah.
I've been trying to get it out for the last half an hour.
She's saying, I've got to go live now. Got to go live. All right, now the next spot, so we go underneath that, the cheekbone or the maxilla there is actually up where the eyebrow meets. Did I just make my eyebrows go the other way? Does that drive you crazy when I do that?
A little bit.
Yeah. Up and under here. And again, same thing, up towards the head here, and apply pressure along the eyebrows like this, and that will also be super sore if you've got any issues. One of the other things I want to let you know, that if you've got congestion in those areas, the sinus areas are actually linked to your eustachian tubes, which are the inner ear. So if you've got issues here, you will probably have popping bubbles, sounds a little bit like you're underwater, feeling in your ears. If you've got pressure on your ears, this technique can help relieve the pressure in your ears. So if you've got earache issues with your children, or if you're having that popping, bubbling sound, I can't quite hear things properly, do this technique that we're about to do, because it can help to relieve that as well. So they're the points we're about to go, but we'll do that laying down so that I can show you. And of course, when I'm doing this, I'm going to be using this on you, baby, so it's going to make your makeup run, but that's okay. Make sure you don't get this in the person's eye that you're doing it, because it's an essential oil. It will sting like crazy.
Yep.
I can't say anything more because it'd be rude.
Yeah. Dark.
Yep. Okay, let's do it. Let's get the pillow and stuff happening. So we're going to get Em to lay down so that you can see this.
Are you going to move that?
Of course I am. Okay. I'm not going to go over there and do it while you're over there and then nobody can see. Okie dokie. All right, Em's just going to do a little bit of a lie down and we're going to just zoom it up. Whoop. So that hopefully, I've got a little bit of extension here. You can see Em's face.
It's really close.
It is a bit close. I'm hoping you can see Em okay there. Insta looks like it's got a good view. Now we do with Facebook as well. Excellent. Now, the most important thing here is to make sure you love and care for the person you're going to do this to. Check. I'm all good with that one. Second thing, seriously, don't get this in people's eyes because it will cane. I don't like being up this close. It just shows me how desperately I need to do my hair. Damn, ISO's killing me.
Oh my gosh, my hair's getting long.
It's killing me. Okay, so we start with a bit of oil on...
Oh, God, it smells so good.
All of these spots. I keep the oil nice and handy. Can you just be careful not to knock that off, please, baby? Yep. Please don't move. And we will start with either of these spots, bottom or the top, and just apply a little bit of pressure. And then I do a little circular motion and then slide my hand on the oil, which is helpful. The oil creates a bit of a lubricant, but it also, of course, is beneficial to actually seep into the skin to help heal and to break up that mucus. Pickles agrees, our bird. We always start on the inside and we work our way out because we're wanting to take the mucus from here and drain it outwards. I do that 3 times. Trying my best not to mess up Em's hair.
It's like steel wool at the moment. So much hairspray.
Love it. Oh, I'm loving the smell of this. I'm going to have my sinuses cleared out just by smelling this.
So good.
If you are doing this to yourself, you can. Absolutely you can. Like I said, it gets a bit tender in some of the spots. And then I always kind of drain down towards the ear at the end. All right, now we're going to go to those other spots we spoke about down on the cheekbone. Be under the cheekbone and then pushing up towards the cheekbone. That's the best results for these sinus points. Just little circular motions as we go, slowly sliding down. And he's got a couple of yucky spots right about there. Feels good, doesn't it, babe?
It does. It's really relaxing. You mustn't be pushing hard enough to not like it.
You're going to get a hockey after this. I can just sense it. And again. Okay, then I get you to take 3 nice deep breaths.
Just smells so good.
All right, and the last part of the technique that I do before I get Em to go and do her own bit is to place my 2 fingers on either side of the end of the eyebrow, grab a hold of the nose. No, I'm not doing this just to be silly. I'm pulling in this direction gently and then moving it right to left,
like
just gently.
Doesn't need to get any bigger.
I love your nose. It's not to cause any discomfort, but it does alter pressure, and often when you do this is when people feel the release go down to the back of their nose or their ears start to go a bit poppy and a bit strange. It just clears the rest of it.
I can feel hockey at the back of my
I thought you would. Now, this is just part A. Part B, which is very important, of course, I don't do directly in my clinic rooms, but I suggest that the patient goes home after having this treatment done. I always do cranials first. 1, boosts the immune system. 2, alters pressures within the skull, so it makes this technique work even better, is to go home and steam yourself up, because if any of this mucus in here is thick and viscous, it'll cling to your sinus passages like, you know what does to a blanket. So if you go and steam it up, it becomes less viscous, more slippery, and it's much easier to get out. So whether that's going into your ensuite, shutting the door, make sure there's no windows open, no fan on, crank the heat up really hot while you get changed, and then of course back to tepid water, hop in. By then you're smelling in the steam, absolutely fantastic. Or stick your head over a bowl of boiling water. Don't burn yourself with a towel, that sort of thing.
Give the skin a facial water.
Yeah, that's right.
Steam.
And just try and inhale a bit of steam to be able to loosen it. But then the key, the most important part of this, and this normally happens when the patients are on their way home from the clinic after they've done this, before they even get in the shower, is that they start to get either the nose will run or it'll start dripping down the back of their throat, or they'll get that feeling like they've got catarrh in the back of their throat. You've got to get rid of it.
Get it out.
Don't sniff it back in again, because then you've just gone and undone what I've just done. Do you know what I mean? I'm just going to smooth out your sinus oil on your face.
My shiny.
You're wearing a little bit. It does. It feels good, doesn't it?
It does.
It's a good technique.
It
but
does.
Pretty simple technique to be able to help ease and unblock a blocked up nose.
Am I shiny?
You are super tiny. All right, so go and give that a go if you have got sinuses, and if you don't, just do it anyway because it feels really good.
It does, and it smells good.
Yeah, so Em will put the links of those products in there if you haven't already got your roll-ons, because it does work heaps better. But you can just do it with finger pressure and what have you. But remember that the oils are specifically designed to assist to break down the mucus, and they're designed to help heal the excess mucosa that's been going on inside your sinus passages to get rid of the bugs.
Those
You know what I
oils,
mean?
you just sniff them and you feel it
Yeah, instantly. Soon you sniff
clearing
it,
already.
your nose clears straight away, which is really handy.
It's really awesome.
Awesome. Well, hopefully that has made a whole lot of sense. And if it doesn't, sorry, maybe rewatch it if you got through part way through. But that is a great way to relieve sinus congestion, any pain, headaches, and what have you that come from your sinuses. Hope that's been helpful. Thanks for having us on your therapeutic journey.